So when you get admitted to a hospital, you might be placed as observation status or inpatient status. So usually this is a medical criteria. If a physician thinks this illness is treatable before 2 midnights in the hospital, you will be placed observation. If they feel like, no, I need more time to treat this, you'll be placed as inpatient. And a lot of times we have to fight with the insurance company. They, like to deny inpatient because as observation patient is responsible for more payment than the insurance company. But this case just blew my mind. So this was an elderly gentleman who came in with shortness of breath. He had bilateral blood clots. He had acute kidney failure, acute respiratory failure, and a UTI. So he was stuck on 3 different drips for multiple days. And day 3 of his hospitalization, I get information that his insurance is declining inpatient status. He was inpatient, of course. This is not observation case. So first thinking was maybe they just don't have all the information. That's what I first thought. So I told them, hey, just make sure they have all of my notes. My notes are very detailed. I bet they're going to overturn. They just don't have all the information. We made sure they did have all the information and they still denied. So I asked for a peer-to-peer, got on the phone with the insurance physician, and they had all the information. Like, I'm like, this is going on, this is what they're on, and some of the things he's reading, like, okay, this is what he's on, this is what he's on. And I was like, and they went, okay, I will overturn and this will be inpatient. Like, they had all the information and it sounded like they were just thinking nobody's going to make an effort to reach out or do anything, so we're just going to say observation. Insane. So this patient stayed in the hospital for 6 total days, and thankfully, they got their inpatient status. So if your family member are admitted anywhere, make sure if you qualify for inpatient medically reasonably, then, if insurance is denying, have your physician reach out. Usually we reach out anyways, patients don't even know. And if you are a physician, please reach out, because sometimes they do this just because they can, and they think you're not going to reach out or make an effort. Okay.